welfare law, and I'm also a supervisor. So that means I'm at the sharp end of seeing how the welfare reforms and austerity cuts have affected our clients. We don't live in a cheap part of the country, as you all know, and most of our service users are people on very low incomes. They're either working minimum wage, they've got 0 hours contracts, or they're in seasonal work. Obviously, a lot of people work in the hotel industry around here. For the working poor, things have got tougher and tougher. Wages and tax credits have not kept up with the high cost of living, and the rents, especially around here, are very high and they're on the up. The government has consistently frozen tax credits since coming to power in 2010, meaning that the gap between the income and the outgoings gets larger and larger, leading to increased debts and hardship, particularly, I have to say, for people now with council tax debts and also utility bills. For this group of our clients, no matter how hard they work, they then never manage to balance the books. Clients in work represent a significant minority of the people to whom we issue food bank vouchers. Clients come to us again and again saying how embarrassed they are that they have to rely on charitable help to feed their families. In every advice day, we give out an average of 4 to 7 vouchers. That's per client, which might represent several people in the family unit. This equates to over 20 a week, and we are not the only agency distributing these around town. Another group hit very hard by austerity measures are the sick, disabled and unemployed. ESA, Employment Support Allowance, is the benefit that's supposed to be given to people too sick to work. Yet a huge number of these claims are refused, despite over a third of these being overturned when they get to tribunals. And many more where people don't pursue the appeal process, quite often because of the stress it causes them. The actual claim process itself is horrendous, and especially for people if English isn't their first language. And as you all know, we have a lot of people in this town from different ethnic minorities, and also for people with mental health issues. Each claimant has to attend a compulsory DWP organised medical. For us, these take place in Brighton or Hastings, incurring further costs to our clients in attending them. We've had 2 clients recently who failed to attend a medical in Hastings because they hadn't got the travel fare. The ESA process has been made worse by a change last year, which removed the right to claim ESA whilst an appeal is being decided. This has forced sick local people onto job seekers allowance, a benefit which after all is for people able to seek work, which clearly those clients aren't able to do. Many of our clients forced onto JSA were too sick to manage a JSA claim and end up being sanctioned, which means that their money gets cut. The maximum sanction that this government has imposed is 3 years. One client with mental health issues was sanctioned for failing to attend a medical, yet part of his condition includes agoraphobia and anxiety. He ended up cut off from his electricity supply because he had not got the money to top up his prepayment meter. In East Sussex, the councils have introduced a crisis scheme called Discretionary East Sussex Support, and it replaces another benefit which was cut by this government, which is the old crisis loans. Unfortunately, the central government funding to provide the local scheme is being cut and is not ring-fenced. And as a result, our county has made claiming harder and harder for these people. So people can't get help for hardship either caused by benefit sanctions. So even if they're appealing these, they can't apply to that scheme. So for people like the client I've just mentioned, there is nowhere to turn for help to put back on his energy supply. Another area of cuts which has had a huge impact on people locally and nationally is the decimation of legal aid. This has caused massive inequality and injustice. Back between 2002 and 2010, I worked delivering legal aid, legal advice to clients with death and social welfare law issues under a civil legal aid contract. That was introduced by the last government. In 2010, the current government removed these issues from the scope of legal aid. This left clients who are really vulnerable and who have disputes against DWP, their housing authorities or large financial institutions like the banks with no specialist legal advice. The government wrongly assumed that these clients could manage these disputes on their own. But these are extremely complex areas of law and time and again, clients who try to resolve these issues on their own come unstuck. Litigants in person who try to do these tribunals and court things are more likely to fail, and they slow up the legal court process through lack of understanding of court procedures. Indeed, judges themselves have recently pointed this very fact out. And it denies a level playing field of access to justice. These areas of law are not the only ones that suffer from austerity. There is now virtually no legal aid for family law. So here again, clients are expected to defend actions themselves without legal expertise. Furthermore, our county court up the road is proposed for closure, which means that litigants of all types will have to travel further to seek justice. The final area I would like to touch on, and there are so many I could go on all night, is that of the so-called bedroom tax. This was introduced to encourage social housing tenants to downsize, but there are not enough social housing properties to allow people to move in this way. The squeeze on housing is only going to get worse, as the government has now said that housing association tenants will have the right to buy. If no new homes are built, then the housing stock will be decimated and more people are likely to end up homeless or insecurely housed in our town. Private rents in Eastbourne are rising and people are already struggling to pay these rents. Secondly, with respect to the bedroom tax, is the effect these enforced changes have on the neighbourhoods and on the vulnerable tenants. One young man I knew with a mental health issue ended up in hospital after an enforced move. He'd been stable with his condition, serious mental health problem, for several years, but the stress of being forced to move from the flat he'd been in for years to a different area where he didn't know anybody pushed him over the edge, and he ended up in hospital. This is a terrible thing on a human level, but in government terms, how much extra did it cost the NHS to pay for this? How much extra did that all cost? The social and community impacts of austerity cannot be overemphasised. It's happening now, it's happening to people you know, and it's happening in our town.